Thank you for joining us. We have 5 speakers this morning, followed by a brief audio Q&A session. We'll start today's update with Mayor John Cooper. Then we'll hear from Dr. Alex Jahangir, Chair of the Metro Board of Health and the Metro Coronavirus Task Force, followed by DeCosta Jenkins of Nashville Electric Service, Scott Potter of Metro Water Services, and Eddie Davidson of Piedmont Natural Gas. We're also joined by Dr. Michael Caldwell, Metro's Public Health Director, Director Chief William Swan of OEM and the Nashville Fire Department, and Rob Mortensen of the Tennessee Hospitality and Tourism Association to help us answer any questions. The WebEx platform should be up and running again, so if you'd like to ask a question over the air during our Q&A session, please click the raise hand button next to your name at any time. And with that, we'll start with Mayor John Cooper.
Good morning. Thank you for joining today. Now we're continuing to practice the social distancing guidelines recommended by the CDC. So we appreciate your cooperation with these video conference updates. Now, pursuant to Tennessee Law Titles 38, 58, and 68, under my administration and the Board of Health, we have declared a civil and public health emergency. Now, we will be establishing further public health protocols restricting service at all restaurants to takeout service throughout Nashville and Davidson County, as well as closing bars and gyms. Dr. Jahangir will be discussing this in more detail. We do want to encourage takeout orders, drive-through service, curbside pickup, and delivery service, as it provides a much-needed public service at this time. I appreciate Rob Mortensen of the Tennessee Hospitality and Tourism Association for being here as the industry representative, both for his support and to answer questions. We've been in frequent contact as we have gotten to this necessary decision. All this is being done to limit the time we are in a restricted service period. Now, hundreds of thousands of residents across Davidson County are recovering from the March 3rd tornado and taking robust social distancing measures to protect themselves and their neighbors as we face this coronavirus challenge. They are our friends, our family, and our neighbors. There are also small business owners, employees, gig economy workers, and customers who are the lifeblood of our local economy. Utility companies have a crucial role to play in working with Nashvillians during these difficult times as we overcome economic hardship as a community. Now, my administration has worked closely with NES, Metro Water, and Piedmont Natural Gas to provide financial relief to all Nashville and Davidson County residents. 2, stop service disconnects for non-payment, discontinue late fees, and work with both residential and commercial customers who have concerns about making their payments, and to provide a grace period during the coronavirus emergency. I want to thank Scott Potter, Eddie Davidson, and DeCosta Jenkins for joining us today. You will hear more from them later in this press conference. Now, many faith organizations are already holding remote worship services and using similar social distancing practices to keep their congregants united while also keeping them safe. Now, I urge all houses of worship to incorporate robust public health protocols for the sake of our entire community. We must all continue to lift each other up and find strength in our faith, but we must do it safely. Even as many of our iconic houses of worship suffered tremendous tornado damage on March 3rd, Nashville's faith community banded together in solidarity to help us recover and rebuild in the aftermath. Now, as we face the challenge of the coronavirus, we will continue to remain united as a community and grounded in our faith. This afternoon, Dr. Jahangir and I will conduct a conference call with faith leaders from across Nashville and Davidson County. The purpose of the call is to update faith leaders about what health officials know about what we must do to keep our congregation safe. I will also encourage our faith community to engage in a weekend of prayer while observing strict social distancing in order to lift all Nashville residents up during these difficult times. Now, I want to extend my gratitude to all Metro personnel, especially our first responders, who have worked so tirelessly over the past several weeks keeping our community safe. I've charged Director Chief William Swan and Chief Steve Anderson to take extra steps to ensure the safety of our first responders while they ensure our safety. I'm also thankful for the frontline healthcare providers across the city who are caring for Nashvillians during this challenging time. As a reminder, you can visit covid.nashville.gov for up-to-date public health information and the status of Metro government services. You can also visit the website to make a contribution to COVID-19 Response Fund, created with the help of the United Way of Greater Nashville to support Nashvillians facing hardships during this time. Today, the United Way will issue its first grants to organizations providing direct assistance to individuals throughout Davidson County. An application process will be posted on covid19.nashville.gov later today for individuals to apply directly. Now I'd like to turn it over to the head of our Coronavirus Task Force, Dr. Alex Yahanger, for additional updates. Thank you very much.
Thank you, Mayor Cooper, and good morning. Let me start by giving you the latest information on the spread of COVID-19 in Nashville and Davidson County. Today, we have a total of 110 confirmed cases. That's an increase of 50 cases in the past 24 hours. The age range is from 11 to 73 years old. Of the confirmed cases, 2 are currently hospitalized. 93 cases are self-isolating at home and have mild symptoms, and 15 people who were confirmed cases have now recovered and are cleared. This is new information, and it's an encouraging to report. As we have said before, the more people who are tested, the more these numbers will rise. Our efforts to flatten the curve continue this morning. We are announcing some additional measures. Dr. Caldwell, the director of the Metro Health Department, later today will order that all restaurants in Davidson County will be closed to dine-in customers. They will be, however, open to takeout orders, drive-thrus, deliveries, and curbside pickup. Furthermore, Dr. Caldwell will order the closure of all gyms and other workout facilities. This is in addition to the bar closures that have already been implemented. These decisions will help us flatten the curve. It will limit the people from gathering in groups, and it is the best way we can help fight the virus. Yesterday, Director Chief Swan and I, as well as our hospital partners and medical school partners, inspected one of our community assessment center sites. Thank you to these leaders for their quick action to build these centers. In just a few days, it's remarkable what this team has accomplished. We are working with all our partners, state, federal, and private sector, to get the supplies to open soon. These centers are located across the city where people will be able to be assessed and, if needed, receive the COVID-19 test. Along with the assessment hotline, these centers are a key part of our COVID-19 response that will help those who think they may have the virus. Residents can call the hotline, and if necessary, they will be directed to the assessment center for further screening. The community assessment system will be in addition to our already robust healthcare system in Nashville, a healthcare system that is currently meeting the healthcare needs of our community. Our hospitals and healthcare professionals are world-class. The assessment system will help further meet the needs of our community and our partners. We're hoping to open these centers soon, and we'll keep you updated as soon as we have more information. Everyone who is watching can help us. Every citizen has a responsibility to slow the spread of this disease. We have said this every day this week, but we need to remind all of you, please practice good common sense measures. Stop going to crowded places. Limit your groups to no more than 10 people. Maintain a 6-foot distance from others whenever possible. Don't shake hands. Wash your hands often with soap and water. And if soap and water is not available, use an alcohol-based hand sanitizer. And cover your mouth and nose with a tissue when coughing and sneezing. And remember, stay at home if you are sick. You know, this morning I had an opportunity to visit my colleagues at Vanderbilt, where I practice, and it just reminds me how much I want to add my thanks also to my fellow healthcare workers on the front lines. We are all in this together, and together we'll be able to make a difference. Thank you very much, and I now turn to Mr. DeCosta Jenkins, President and CEO of Nashville Electric Service.
Good morning. First, I'd like to say that our hearts go out to everyone that's been directly or indirectly impacted by the COVID-19 pandemic. At NES, we continue working to provide safe and reliable power to our customers 24 hours a day, 7 days a week. We understand the economic strain this pandemic is causing and want to do as much as we can to help our customers in need. Therefore, NES is suspending all power disconnects for non-payments until May 31st. We encourage customers to pay by phone, by credit card, or ACH transfer. NES will all waive late fee charges and will absorb credit card fees on behalf of our customers during that period. We will also make extended payment arrangements for all customers in need. NES will be working with commercial customers on billing and payment concerns, as well as potential energy management issues once the production restarts to avoid and reduce potential negative impacts. NES provides an essential service and as such remains open to serve our customers. Our lobby is open but will be limited to only 10 customers at a time. Health and safety are NES's top priority. We regularly clean and sanitize all customer contact surfaces. Hand sanitizers are also available for customer use. We've also taken measures to ensure safe distancing and rotating shifts for all of our employees. Nashvillians are known for the power of working together, and we will continue to look for ways to help our customers navigate these challenging times. We encourage our customers to go to nespower.com to keep up with the latest updates as circumstances change. With that, I'm going to turn it over to the Director of Water Services, Scott Potter.
Thank you, DeCosta. First and foremost, I want to reassure everyone that's a customer of Metro Water Services that your water is safe. It has been safe, and it will remain safe as we go through this difficult time. Any Metro Water Services customer that needs to defer payment over the next 2 months is encouraged to call 615-862-4600. Any account balance that is deferred over the next 2 months will be spread out over the next 12 months, so we're not adding an additional financial burden on any of our customers. Metro Water Services will not assess late fees and will not disconnect water services for the next 2 months. Please be reminded that we're experiencing a high volume of calls, and it's not necessary that you all call today. We're not going to be turning off people for 2 months, no late fees for 2 months, so you can call today, and you can call next week. But please be patient as we are experiencing a high volume of calls. Your water is safe. I'd like to introduce Mr. Eddie Davidson, the Director of Government Affairs for Piedmont Natural Gas.
Good morning. At Piedmont Natural Gas, our highest responsibility to you is the delivery of reliable natural gas service. That's always important, but never more so than now as we navigate this unprecedented time together. Beyond that, we're committed to finding additional ways to help protect and serve the whole community, and especially those who are most vulnerable. Here's an update on some of what we're doing. As we had announced immediately following the tornado, Piedmont Natural Gas is suspending disconnections for non-payment. We are continuing to suspend disconnections as the impact of the coronavirus on our customers is just now beginning to be felt. We are also waiving late fees and insufficient check fees. In addition, we're offering flexible payment terms to our customers upon request. Our customer service team will use all the tools we have available to help each individual customer's situation. Whether you need extended payment terms, interest-free extensions, or assistance with balance billing, our team will work with you. I also want to be clear that these solutions are available for both residential and business customers. If your business is impacted, we're there for you as well. So if you're in need of any of this type of assistance, please call our customer service number at 1-800-752-7504 and let our team find the right solution for you. When you get your bill, if you're having difficulty with it, don't just throw it away. Call us. We'll work it out. Again, our number, 1-800-752-7504, and you can also get updates on what's happening with Piedmont Natural Gas at www.piedmontng.com.
Thank you, everyone. We will now start the Q&A portion of today's event. As time allows, if you've clicked the raise hand button next to your name, I will go off camera, announce your name aloud, which means that you've been unmuted, and you may proceed to ask your question.
Good morning. This is Dr. Tequila with News 4. The money that's going to be dispersed to the organization to help people dealing with difficulties, can you explain that process again? How quickly that's going to work, how people can apply, and I guess how quickly they're going to be able to get their money, like residents?
Well, thank you for that question. This is a little bit of a work in progress. The fund is a couple of days old. The things to keep in mind is the United Way, which is managing the fund, is going to be making direct payments to organizations that then will help individuals. But individuals also need to know that starting today, they can go to covid.19.nashville.gov and make an application directly for individual assistance. Now, the money is coming in fairly rapidly. We don't know the extent of the application and the need, but we're trying to determine a process today and working with the United Way to get the money where it needs to go to do the most help. But individuals may apply, and then also nonprofits that are distributing money to individuals also may apply. And you can do it directly on the website. Thank you.
Hello, this is Peter White from the Tribune. This question is for Dr. Devinder. It's a two-part question. You said that you expect more positives the more people you test. Two parts. One, can you estimate how many people are being tested in Davidson County today? And part two, now that testing has been ramped up, will it become widespread? By that I mean, will you start to test non-symptomatic patients?
Mr. White, thank you so much for that question. So the first part of how many tests are being conducted, as we've discussed several times before, testing in this community is conducted in multiple places. One is the state lab, several private institutions, and private labs. With that said, I believe it was reported just yesterday that Vanderbilt University Medical Center, it's by themselves have tested over 3,000 individuals. I know the Tennessee Department of Health has tested many hundreds, if not thousands, and others. Regarding your second question about will the indication change, the short answer is I think we, and I believe most of the medical systems in this place, will go by CDC guidelines. We have to make sure that everything is a scarce resource, right? So the people who should be assessed are people who have a dry cough, a fever, or have shortness of breath. I think we have to be judicious in our medical use and follow those guidelines. And I suspect most of my partners here will refer to the CDC for those guidelines. Thank you so much.
It looks like that's all the questions that we have. Later today, a video recording of this event will be made available, and you will all receive a link for the next video conference. Thank you for joining us, and be well.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.org.